ever wonder what therapists talk about over coffee? Well, we're three clinical psychologists, Dr. Diana Hill, Dr. Rae Littlewood, and Dr. Debbie Sorensen, and we'd like to welcome you to Psychologists Off the Clock. In this podcast, you'll get a glimpse into the books we read, the research we think is interesting, and the ideas from psychology that we use to thrive in our own lives. Our webpage is www.offtheclockpsych.com, and there you can find resources we mention in this episode as well as other podcasts we've posted. You can also find us on iTunes, Facebook, and Twitter. Thanks for listening.
Welcome to the podcast. I'm Dr. Rae Littlewood, and today on the podcast, I'm going to be continuing my conversation with my friend and colleague, Dr. Liza Mermelstein. Hi, Liza.
Hi, Rae. Great to be back.
Yeah, last week we talked a lot about the relationship between hormones and mood. For women in particular. And today we're going to be continuing that conversation, but shifting our perspective to talking about the changes that accompany pregnancy. So we're going to start off by talking a little bit about what kind of hormone changes accompany trying to conceive and pregnancy, and then we're also going to be talking about postpartum adjustment related to the hormone changes and also the stressors that come with being a new parent.
I think that pregnancy can be a very exciting time, but it also can be very stressful, and there's a lot of hormonal changes that occur sort of during the prenatal and then postpartum period. More hormones than a woman will ever experience in her lifetime.
Absolutely. Last time on the first part of this episode, on part 1 of hormones and mood, we talked about the changes in hormones that occur during a normal menstrual cycle, and then when those changes lead to more severe mood symptoms. For example, in premenstrual dysphoric disorder. So, got some good information. If you haven't listened to that episode, go back and listen. We're just going to recap a little bit by talking about the changes that are happening in the menstrual cycle when you're trying to conceive. So first, if you think about a normal menstrual cycle that occurs over the course of around 28 days, the first 10 days are the period of time where you're relatively infertile and your hormones overall are pretty low. So FSH, estrogen, and progesterone are the main hormones that are changing during your cycle. And during the early part of your cycle, those are all pretty low. Around day 10, estrogen starts to increase, and that is the fertile phase of your cycle. Estrogen gradually increases over about 4 or 5 days, and during the average cycle, a woman will ovulate around day 14, which is accompanied by a spike in luteinizing hormone. At that time, if you do conceive, then estrogen continues to increase. So during a cycle where you don't conceive, after that, after you ovulate, estrogen will fall. And as we talked about last time, that's the period of fluctuation with estrogen that can be associated with premenstrual syndrome. So we're going to be focusing today on the changes that happen when you do conceive. So first and foremost, when you conceive, there's a huge increase in HCG, and that is the hormone that pregnancy tests detect. So if anybody listening has been pregnant before, you know that when you're in those early days of your pregnancy and if you're going to the doctor to get blood tests, HCG levels are what are reported, and change in HCG during the first couple of weeks of pregnancy are really looked at to determine sort of the viability of the pregnancy. After that period of about 3 months, HCG starts to decrease, and estrogen and progesterone during those first 3 months are gradually increasing. But really the largest increase is in HCG, and that's what produces those early pregnancy symptoms that can be so disruptive to a woman. Things like fatigue and breast soreness and
morning sickness.
Morning sickness, yes. So throughout pregnancy, estrogen and progesterone are both gradually increasing and will reach the highest levels that a woman will experience at any time during her life, right before giving birth. And the reason that these hormones are increasing so much is that they are the placenta is the major source of progesterone and estrogen, which means that these hormones drop off within hours of delivery. And the effect of this sudden hormone change is much more intense than the premenstrual drop in estrogen and progesterone. And at the same time, other hormones also drop off in the first few hours and days after delivery. Those hormones are things like prolactin, cortisol, HCG, and endorphins.
Yeah, so Rae, as we talked about last time, there is a lot of hormonal change going on, and for some women who are sort of more sensitive to hormonal change, this can be a risk period for experiencing disruptive mood symptoms. So, you tend to be at higher risk for something like prenatal or postpartum depression if you also experienced mood-related symptoms in relationship to sort of your normal menstrual cycle. So if you were someone who was diagnosed with severe PMS or PMDD, then you're also at risk for experiencing a mood-related disorder during pregnancy or postpartum. And so, really I think that there's a lot of focus on postpartum depression, but at least half of postpartum depression begins prenatally, and the prevalence of prenatal depression is almost as high as postpartum depression. It can be really difficult to assess prenatal depression because so many of the symptoms of a normal pregnancy kind of mimic depression, so kind of having difficulty sleeping, changes in appetite, really low energy, poor concentration. And so often prenatal depression is misattributed to, that's just pregnancy. And that's unfortunate because this can be a period of time when proper treatment can really help decrease the likelihood of postpartum depression.
Yeah, that's a really good point. Yeah, kind of having an infrastructure, if you're somebody who has a history of either a mood or anxiety disorder prior to pregnancy, having that infrastructure in place, either a therapist or psychiatrist, and talking about, sort of like you said, the risks of what that come with pregnancy is really a good idea for heading off the risk for postpartum depression.
Yeah, and I think that one of the benefits of psychotherapy and going through sort of like a cognitive behavioral treatment for depression or like that is that you have tools which can then decrease the likelihood of sort of a relapse in the future. And so even if you maybe went through treatment for depression sort of in the past and then you're planning on conceiving or you are pregnant, then maybe just getting a little bit of kind of some booster sessions that can help you sort of remember some of the skills that were helpful when you struggled with depression in the past to really utilize during this sort of higher risk period can be really helpful, I think, in sort of heading this off.
Yeah, and to add to that, if you're seeing somebody who is educated in reproductive mental health, then they'll also be able to talk to you, like we're going to talk today, about what the reality is of mood changes pre and post pregnancy. So, for example, most women experience what are called baby blues. And those can also be called postpartum blues. And that is the result of the dramatic drop in estrogen and progesterone following delivery.
coupled with sort of adjustment to new parenthood and sort of the sleep deprivation that comes along with that in those first couple of days. And most women are going to experience this. Usually it occurs during the first 2 weeks following delivery, but many women describe mood changes in sort of the first 24 to 48 hours following delivery. And this is totally normal. Symptoms can include, crying for no reason, sort of emotional lability, mild irritability and frustration, sort of feelings of anxiety and feeling overwhelmed. And it's important not to pathologize this, that this is normal, getting some help, maybe getting a nap, getting outside of the house, that these are all really helpful ways to kind of deal with this normal change in hormones and adjustment to this new life phase.
Yeah, so like you said, Liza, the symptoms of the very common baby blues look like dramatic sort of mood swings from crying seemingly for no reason or feeling sad or overwhelmed. But what kind of differentiates baby blues from something to be more concerned about, which is the development of postpartum depression, is that generally speaking, it lasts a pretty short period of time. Like you said, I think it resolves in usually about 2 weeks. And there will also be periods during those mood swings of, your mood swinging the other direction, that you're sort of overwhelmed with joy and amazement for your newborn, and really able to sort of see the bigger picture, that this is just a change in emotion that may be hormonally related and nothing to be panicked about, and having support around you during that time. That sort of reinforces that message that this is normal, and that we're here to sort of be on that roller coaster with you. Many women wonder how postpartum depression is different from depression, and how to differentiate those baby blues from the development of postpartum depression.
And just one thing to note, Rae, is that, postpartum depression is not in itself a diagnosis, but it's a sort of specifier for a depressive disorder that is sort of specified as with peripartum onset. And what this means is that the onset is either during pregnancy or in the 4 weeks postpartum.
Okay.
And so then, thinking about it clinically, and maybe a little bit of kind of what we see and what our experience has been, there are things that do differentiate sort of a postpartum depression from sort of depression at another point in a woman's life. And, that has to do with sort of some of the what else is occurring at this time, bringing home the baby. And,
so the ways in which postpartum depression really is different from clinical depression during another phase of life is that it's occurring during this time in this context of motherhood, which is a context that is driven by this sort of lifelong accumulation of expectations about what that's going to be like. Your dreams and values and hopes and beliefs, both about giving birth and what that's going to be like, and then also what your relationship with the baby is going to be like, what it's going to be like to be a mom. And there's this myth that the postpartum period is just delightful, and that women who struggle from postpartum depression really have to struggle with the disappointments of those expectations that you may have built up over your life. There's lots of feedback from your environment, which really suggests to you that this should be, this period of elation. People are saying things like, aren't you just thrilled? Isn't having a baby so wonderful? And so much of the attention is on the baby, right? And that can really lead to some sense of guilt for having those kind of less than ecstatic thoughts. The second difference for postpartum depression in relation to clinical depression at other phases is that this is happening at the most demanding time of a woman's life. It's an overwhelming responsibility for caring for the infant, chronic sleep deprivation, and the stress of physically healing after birth can really exacerbate the symptoms of depression and make recovery more difficult. And the stakes are really high. People who are experiencing symptoms of postpartum depression worry about how that's going to impact their baby, bonding with the baby, future ideas about having more children, nursing, and just, how am I as a mother?
Yeah, I think that because there are so many sort of expectations that can come from so many different directions placed on, new mothers, then it can be really stigmatizing to kind of acknowledge and seek help for postpartum depression. So as a result, not only is sort of guilt and sort of disproportional guilt one of the symptoms of depression, but then you have this idea of what does this mean about me as a mother? And particularly if you had previous kind of expectations about what kind of mother you were going to be, that makes it really hard. I know that both Rae and I have had conversations about just sort of culturally now, what are some of the implications of, women waiting longer to have children, more women dealing with sort of infertility treatments, and sometimes by the time that you have your first child, there's been so many years to kind of build up kind of expectations and maybe lots of time of frustrations of thinking, if only I had a baby, I would be happy. Mm-hmm. And so then if you're not feeling happy all of the time, that can be really, really challenging.
Yeah, that's a really important point, Liza. I think there's a lot of research that looks at parental satisfaction or satisfaction of being a parent at different phases during life. And definitely, as we have seen the rates of first pregnancy move further down a woman's lifespan, so more women are having children in their late 30s and early 40s. It's a different context, and it can be one where you have either sort of gotten to that point because you've struggled along the way with infertility, or it may just be that you've delayed having children because of other goals and responsibilities like a career. And so just the context that it's happening in is really different depending on what your experiences have been leading up to having a baby.
And I think it's, some of the research that looks at sort of satisfaction with kind of children in the U.S. really kind of highlights how, compared to other developed countries, we have such poor support for parents. I don't think it's news to anyone that, we're one of the only countries that, doesn't have sort of parental leave practices and that sort of thing, or not feeling like you have job security, not feeling like you're able to kind of take the time that you need to bond with your baby. Financial pressures, giving birth can be very expensive, and all of those things I think can contribute to just this difficulty in adjustment.
Yeah, absolutely. I want to transition our conversation that it's not just depression that can become a problem in the postpartum phase. General anxiety and specific types of anxiety like obsessive compulsive disorder are more and more acknowledged as problems postpartum. So in talking about anxiety disorders after childbirth, we've already talked extensively about postpartum depression, and most often that occurs as a primary illness by itself. However, there's also related anxiety disorders that can either accompany or follow postpartum depression. Postpartum anxiety syndromes have been getting more attention and are now more understood to be a part of postpartum depression. So panic disorder and OCD, and can be diagnosed during and after pregnancy, and can also be exacerbated by childbirth. So there's a lot of overlap between postpartum depression and postpartum anxiety, and many women with anxiety during this period say they've always been worriers. So it's common, just like with depression, for women who have a history of anxiety to experience a worsening of these symptoms during the postpartum period.
And so I think, again, with kind of mood-related issues, it's really normal to be anxious when you are bringing home an infant.
Yeah.
Right? It's really common for parents to kind of wake up in the middle of the night to check that the baby is still breathing. And so that's not really what we're talking about here. We're talking about sort of anxiety to the point where sort of frequent checking on the baby, worrying about the baby's safety, gets to the point where you're not able to do anything else other than think about the baby and how to keep it safe. This often is accompanied by kind of high levels of seeking reassurance, maybe lots of visits or calls to the pediatrician, not able to take care of yourself. It's normal to experience sleep deprivation, but typically when the baby's sleeping, if there's a high level of anxiety, then maybe mom isn't able to sleep even during those periods.
Right. And then that sort of feeds this, really negative cycle of the more sleep deprived you are, the more anxious you are, the more sort of unrealistic you might be about specific threats to safety, right? And when you get into that sort of distorted, really overwhelmed, anxious period of time, it can be really helpful to have people who are on the sidelines who can step in and help, or can at least identify when things are getting a little bit too extreme in your thinking. But for some people, that that perspective from the outside isn't available, and so this podcast today is really for all of those people, right? So if you are somebody who is experiencing anxiety in the context of being a new parent, we really want to talk about how do you know when you've sort of crossed the line and you need to get help.
Yeah, and I think similarly with postpartum OCD, again, it's really common to experience sort of obsessional or scary thoughts about the newborn. Upwards of 90% of new parents will report some sort of thought, I'm going to drop my baby. And the thoughts themselves, this is super common and kind of, I think, a way that we're just sort of adjusting to new parenthood and having this helpless newborn.
And many of those thoughts continue, right? It's not just about having an infant. It's just the responsibility of being a parent. And, are both my kids in their car seats, or have I left one on the, the floor of the garage and I'm going to back over them? I mean, I'm laughing while I say that because I think about that literally every time I pull out of the garage, and I go very slowly pulling out of the garage because even though I know I've put both of them in the car seat, there's this part of me that's like, that just has this this really uncomfortable image in my mind of something bad happening to my kid. And so that's, I hope, really normal. I think it is.
No, right. It really is. And it's sort of not the presence of thoughts that's problematic. It's how you respond to those thoughts, right? So if you were to tell me that, well, I've stopped driving because I'm terrified that I'm going to run over my child,
right.
Then I'd say, okay, well, let's talk about that a little bit. And so it's really how you respond to your thoughts that's going to be that's going to determine whether this becomes sort of something that really is in need of clinical intervention.
Right. Yeah, I think another example Liza and I have been talking about lately, because both of us have children that we're trying to get to sleep through the night. And that's this really, fun, exhausting period of time where there's a double-edged sword, right? When they sleep through the night, there is this thought when you wake up in the morning and you've slept for an unexpectedly long period of time, that you're sort of listening for uh-oh.
Right.
And so the ability to sort of like lay in bed and sort of tolerate that question rather than jump up and immediately go check to make sure that your kid is breathing. Like that's kind of sort of one example of where to draw the line, right? Like
it's kind of if you go in, then you probably wake them up.
Right.
So
right.
it's being able to tolerate that, uncertain thought that really you just have to kind of, tolerate.
Yeah, you'd have to tolerate and sort of trust. And after enough, enough sort of experiences of, a couple minutes later you hear them wake up, or an hour later you hear them wake up, and that sort of gets normalized over time. So in the next section, I think we're going to transition to talk a little bit more about this decision about when is something a problem. And we just talked about that in relation to anxiety and kind of like the obsessions that come with obsessive thinking and checking that can be a normal part of adjusting, that you do need to sort of be able to determine when something has become a problem, and then what are the treatment options for either postpartum depression or anxiety. Pediatrician is the usual place that I think a lot of new parents start, and pediatricians are a great resource for being able to normalize what kinds of problems you should be going to the pediatrician for, and what kinds of problems you can deal with at home without a doctor visit. There's also a lot of resources on the internet for postpartum depression. Postpartum.net is the Postpartum International Support Alliance that has resources for new parents, and also listings for support groups in your area that you can check out. So the overall message with thinking about whether or not this is something I need to get help with is that there are many, many different things that are recommended to deal with postpartum adjustment issues. Some of the ideas that are out there that we are going to talk about today are getting support in the house, sleep restoration, getting a professional consultation, and also pharmacological interventions.
And so you can think about all of these things sort of on kind of a spectrum. Like maybe if you acknowledge that you're, just having a lot of worries, and, maybe your partner or a parent or a friend is saying, that seems like you're worrying a lot, then maybe you first sort of seek out some more kind of informal support. Maybe you find support group in the community, like Rae mentioned, or something that'll just give you some reference points. I know that was helpful for me, even that, Rae, her youngest, is about a year older than my son. So sometimes I'd say, is this normal? Or, and that for me was really helpful to kind of get some perspective.
But when you're somebody who thinks that you might have postpartum depression, it can feel kind of stigmatizing to talk about some of the more intense thoughts and feelings that you experience. Obviously we're both psychologists, so I don't think there's any, threat in talking about some of the more difficult parts of adjusting as a new mom. But some people don't have that, that in their lives. There's a book that I really recommend to patients that's called This Isn't What I Expected by Kleiman and Raskin.
System, if you have a good support system, and maybe you can try some self-help books, and then it might be time to kind of contact a specialist, and that could be in the form of kind of talking to your pediatrician, getting some recommendations, looking online for sort of a therapist or a psychologist, contacting your primary care physician, and there's different resources depending on the types of difficulties that you're having. So breastfeeding and difficulties with breastfeeding, if that can be a major stressor, and if you're already experiencing some postpartum depression or anxiety, and then on top of that you have difficulties with nursing, getting some help specifically with nursing, going to
the national support organizations for breastfeeding, local organizations, oftentimes birth centers or hospitals will have breastfeeding support available. So a couple of things that are recommended for additional support when you are experiencing either signs that you might be experiencing postpartum depression or you're actually experiencing postpartum depression. A couple of things are getting support in the home and also sleep restoration.
Yeah, so sometimes, particularly in more mild forms of postpartum depression, just getting 4 to 5 hours of uninterrupted sleep for a few days in a row can be enough to really kind of start recovery. And so, this you need to be kind of creative about how you're going to do this, particularly if you're breastfeeding. But, some way that this might look is that maybe there's a certain part of the night that, you're sleeping in a different room from, the baby, maybe a different room from your spouse, and a spouse or a parent or a hired mommy helper or postpartum doula could bring your baby into you when he or she needs to nurse, and then takes the baby back when he or she is finished, and does all the other care, the diaper changes, the kind of rocking her, the walking around, and you can really be sort of focused on just sleeping and nursing when that need occurs.
Right. And that, that can be helpful at any phase. I think oftentimes people are really focused on, those 2 weeks to a month postpartum as this, everybody's sort of attending to the new parents and coming in to visit. And really, the period of risk for postpartum depression extends past a month, right? It can be within the first 3 to 6 months after delivery. And so I know a lot of parents experience sort of this roller coaster of stress related to people coming to help or visit, and periods of time where it might feel like things are getting better, and then maybe you lose some of the support that you had, and sort of the reality hits that, whoa, I'm not getting enough sleep, and I can't think straight, and me and my partner are, at each other's throat. I had this agreement. I always would say to Dave, what happens at 3 a.m. stays at 3 a.m. Because there are times where you're just like, I don't know, you just are really, expletive, because you're just so tired, right? So...
And then sort of setting up an appointment with a psychologist or a therapist. And, now there's a lot of information that you can find out online, but, also often just kind of asking some questions to find out if the person is going to be a good fit for you. What type of orientation they have they worked with, specifically with postpartum depression or anxiety or whatever it is that you're dealing with, and finding someone who can help support you in this process.
And then, a lot of people are jump right to that question of like, oh my gosh, am I going to have to take medication? And, medication during pregnancy and postpartum, if you're nursing, is a really complicated issue. So, the first step is to see somebody who's qualified to help you make the diagnosis. And the second step is to sort of look at, is talk therapy alone enough? And oftentimes it is. And then there's some, forms of postpartum depression where all the talk therapy and, support in the world just doesn't touch it, and medication becomes really necessary and can really be helpful in a short period of time.
Right. Yeah, and I always kind of advise people just kind of consider all your options. Even if you go and, meet with a psychiatrist, that still doesn't commit you to taking medication if it's something that you decide, well, after hearing all the information and weighing the options, I'm going to make the decision not to take medication. But just kind of finding out what's out there. I think there's more and more evidence that, taking medication kind of during pregnancy and postpartum, certain medications, there's different risk factors, but risk profiles, but certain medications are pretty safe. And, I think the bottom line is that untreated depression or untreated mental health is, that's what we want to avoid.
Yeah. Yeah, and so for people who've had experiences taking an antidepressant, for example, prior to pregnancy, if you've had some success with that, then most likely taking that same medication postpartum will be effective.
In severe forms of postpartum depression, it often is going to be most effective to, have some combination of medication and talk therapy.
Yeah.
But these are questions that, finding a provider who you can kind of talk these things out with can be really, really important.
Yeah, I think just to make it clear, certain symptoms such as loss of concentration, severe insomnia, confusion, extreme indecisiveness, and suicidal thoughts, or severe feelings of guilt can really make it difficult for talk therapy alone to be effective. And so medication can often stabilize these symptoms enough to allow you to kind of invest more energy in your psychological care. Today we've talked about the relationship between hormones and mood during the prenatal and postpartum periods of a woman's life. And it's been really fun to get together and talk with you again, Liza.
Definitely.
Thank you for coming on the show.
Well, thank you for having me.
We'll be putting up some resources on our website to give you more information and direction on postpartum depression and anxiety, and check it out.
Thank you for listening to Psychologists Off the Clock. You can find us on Twitter, Facebook, and iTunes. You can also find us at www.offtheclockpsych.com. That's offtheclock, PSYCH.com. Music by John Gu and Susie Stevens.